Hello there, and welcome everybody to our Somatic Psychedelic Facilitation 9-month Advanced Mentorship Free Information Call. I'm Atira, and I am really happy to welcome you here to our information session. And joining me today is the very beautiful Dr. Devon Christie, which I might add here as a spotlight. Oops. Yes. Hey there, Devon. Good to see you here. Yeah, so we're really excited to welcome everyone here today. And just as we kind of settle and as we connect in a group together, it'd be really beautiful for you to share in the Zoom chat where you might be zooming in from. I love to see who is calling in from around the world. So I'm calling in from the north of Thailand, in this place called Chiang Mai. It's just really special and really wonderful to welcome you all here today, joining us in this free information session. So really wanting to extend a really hearty and warm welcome to all of you here. Devon and I are really excited to be sharing a little bit more information about this advanced mentorship program that's going to be starting from October until June next year. So as you're sharing where you might be calling in from the Zoom chat, I'm seeing some folks calling in from Maryland. Hello, Elsa. Good to see you here. Chantel's calling in from Vancouver. Welcome, Chantel. Ella's calling in from Spain. Oh, I've got Rosa actually calling from the Northern Rivers. Welcome, Rosa. It's so good to see you here today. We've got Elke calling in from Amsterdam. Yeah, and also Shelly calling in from Palm Springs, California, and Monica calling in from Durham. Yes, so welcome everybody. Welcome. So I would love to introduce actually our team. So Devon and I have this vision of this mentorship program that we're running from October to June. And as we start, I would love to really welcome Devon here. So yeah, welcome Devon. It's so good to be sharing space with you.
Thank you, Tara. It's so wonderful to be here with you and with everyone who's joining us today.
Yes. So a little of the backstory with Devon and I, we're both co-directors of the Somatic Psychedelic Facilitator 50-hour program with the Embodied Lab. And both Devon and I, we have a very similar and shared values and vision of the psychedelic world and how we can keep and offer kind of safety and attunement and presence with the people that we are working with in psychedelic practice. So the 50-hour program, we felt as experienced psychedelic practitioners that it was just a dip in the toes of the pool of what we can offer to this space. And therefore, here is the advanced mentorship program. So, Devon, I don't know if you have anything to share around, around that and a little bit of this mentorship and how, we work so beautifully together, don't we? It's just such a beautiful relationship that we share.
Absolutely. Yeah. I think this mentorship is a natural extension, really, of the 50-hour collaboration with Embody Lab, which is also a beautiful program and certainly something to look into if you're on this call and you haven't done that program. It's not a requirement for taking this advanced mentorship with us. However, it does provide a wonderful foundation for kind of the areas of practice and the orientation and philosophy and skills and kind of how we cultivate ourselves and our presence that we're going to be really diving into in this advanced mentorship. And I'll speak a little bit more kind of about the vision. I have a little bit of story to share about how Atira and I met and sort of where I was coming from before we met actually on a panel at the Embodied Lab. But I'll share that in my section in a little bit.
Thank you so much, Devon. So I would love to share now and orient you to our structure for the info session for today. So for those of you who just joined in, welcome to our free information session. Today we are going to be sharing, this is the overview. So here we are at the welcome, introductions, and orientation part. And after this, we would do a longer introduction of myself and Devon before going into the vision really behind the mentorship program. Then we'll touch a little bit around logistics, who this program is for, our curriculum, how you'll be learning the structure of this mentorship program, what you will receive as part of the mentorship before moving into question and answer and then closing. So if you have some questions to submit for Q&A, please feel free to reach out to Carla in the Zoom chat and you can share your questions there. So I'd love to introduce you to this, just Devon, one of our co-directors and just someone that I really, just really love kind of working with. It's kind of difficult sometimes to find a person that shares the same kind of values and vision in the psychedelic space because there's so many ways of working in psychedelics. So here I'd love to invite Devon to share a little bit more about herself.
Yeah, thank you so much, Atira. So I have my kind of professional bio posted here, which please go ahead and read that. It has some of the more details about some of the positions that I occupy, etc. I think just as an overview, I come to this I would say firstly, as a human being who's been doing my own healing work for decades now. And my life journey, my career journey led me to medicine, and I became a medical doctor, first best specializing in rural family medicine, and but always very much holistically oriented since before I entered medical school. And a lot of that had to do with what actually helped me on my personal healing journey, which wasn't always what the doctors did or offered. I found a lot of other ways to find healing. And one of the more important ways for me was through stumbling across yoga and meditation practice when I was 17. This would have been in the early 90s. So really before yoga was a more of a widespread thing here in North America. And so my holistic orientation as a medical doctor and my personal healing journey has sort of led me to continue to look and have this real passion for uncovering and finding what different methods or practices are going to help us to heal and to actually heal, not to band-aid, which I find in the medical profession, especially when we talk about mental health and chronic illness, a lot of the treatments available are more about symptom management. And so from kind of my interest in integrative and functional medicine, I certified to be a functional medicine physician practitioner. And then I studied mindfulness-based stress reduction, which is a really, if you haven't done it or heard of it, it's a very evidence-based 8-week program teaching mindfulness. And I became certified in that and started teaching it to my patients. And ultimately, though, even within the people taking that program with me, which was really powerful and really helped to shift people's orientation to stress, I still found that trauma, people with PTSD or trauma history still struggled in that program. For example, doing body scans and other practices that I was inviting them into. And that's kind of what inspired me to go on and become a trauma therapist. And around that same time is when I learned about MAPS and the work that was happening with MDMA, the research with MDMA for PTSD. And I kind of, my own personal journey dove into the plant medicine world as well, through just some happenstance introductions to folks here where I live, which I do live here in the beautiful Pacific Northwest on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people, also known as Vancouver, BC. And fortunately, I think for me, when I landed here in 2011, I actually became introduced to a lot of folks who were kind of early folks in the psychedelic renaissance, as it's been referred to in some places here in Vancouver. And yeah, that's kind of what led me along. And all the while, I think the root of embodied self-awareness and cultivating that has guided me and guided my personal healing journey. And what I've discovered that has been most supportive to folks: relational somatic trauma healing, mindfulness, and later internal family systems, which I've also studied, and level 1 IFS, and on the certification path for that right now. So um, I could say more, but I just really wanted to share a bit of an orientation to how I've come to this work, that it's very much woven into my own personal healing, and that I think my orientation is it. Essentially, I really believe that looking at things through multiple lenses of understanding, that there's more than one way. You know, science and medicine is very valuable, but there are indigenous and shamanic worldviews and lenses. There are the worldviews and lenses of the disciplines like Vedanta and yoga that I've mentioned, I've studied. There are so many lenses to look through. And I think that's really where Atira and I kind of come together in a shared orientation, despite our kind of different backgrounds, coming from me more from the clinical side professionally, and Atira coming in with a lot of her own grounded history in the ceremonial context with plant medicine. So I'll leave it there for now. And I really do look forward to learning and meeting more about all of you. Hopefully, those of you who join us in this mentorship, and sharing more about myself then. So over to you, Atira, for your introduction.
Yeah, thank you so much, Devon. And what I really appreciated about that share is this really kind of beautiful kind of mapping and like connection of the different lenses, the multiple lenses that you kind of talk about. And what I really love, I think, hearing about that is that commitment that you have to healing, you know, from a medical lens. And also, I think the word that came up for me is that how you kind of view healing is so multidimensional and also really holistic and really connected to wholeness, you know, this philosophy and principle of wholeness that is so foundational, I think, in what sets this advanced mentorship kind of apart from some other psychedelic trainings, that kind of multiple lens approach. So yeah, thanks so much, Devon, for that. So as Devon mentioned, you can read a little bit of my professional bio here. But what I really did kind of want to share, as Devon shared more of her personal journey, I also want to share a little bit, not just around my professional journey, but really also of my personal story. So I was born in Southeast Asia. I was born in Singapore and I immigrated to Australia. So I'm an immigrant. And in that story, my backstory is that I'm also a survivor of complex, you know, post-traumatic stress disorder, or most commonly known as CPTSD. And I just kind of wanted to share this with everybody because the way that I work really comes from my personal lived experience around trauma. So my understanding of trauma is not only professional, it is something that comes deeply from my lived experience as a BIPOC woman, a woman of color, and also my lived experiences of, you know, displacement, oppression, abuse, violence, neglect within my own personal family history or system, and also within larger cultural, religious, political, and patriarchal systemic influences. Because when we kind of look at trauma, I think this is really important to share. A lot of people kind of think of trauma as a single experience, perhaps, but actually, who we are as people are shaped by all of these different layers. And part of being, a psychedelic practitioner who is attuned with those layers, we kind of need to also understand our own lens and those systems that have also shaped us, because that's what we also bring into the room. And for nearly 2 decades, I also worked on the front lines as a trauma specialist and educator. And yeah, in international development, I worked in refugee camps, disaster relief, survivors of war and torture. And mostly my work was really working with girls and women who had been sold into sex slavery, trafficking, and exploitation in Asia. So I've worked with thousands and thousands of bodies, in this work, and also working from a cross-cultural lens in a lot of settings. So that's really, when I kind of think about my training, my work in trauma, just working with a lot of nervous systems and physiology and, different the stories of people's bodies, irregardless of whatever culture we come from, the body really holds a story. And so, one of my, I think, greatest passions and loves is supporting other people to really kind of connect to the body in their story that they're sharing. Because, especially in psychedelic spaces, you can understand a trauma imprint with your mind intellectually, but especially in psychedelic spaces, the body really starts to share its story. So part of this mentorship is around how can we start to read, how can we start to hold the narrative in the body. So in addition to that, I've also spent over 30 years healing my own complex trauma with psychedelics. I first started psychedelics in 1994. So, and the phase that I've been through in psychedelics, like there are many phases in the psychedelic healing journey. I've been through some of these phases. And some of these phases actually included being re-traumatized by, I would say, more the facilitators and the practitioners that were holding space, not so much by the medicine. It was mostly guys that were unskilled or misattuned or just untrauma informed, which was one of the reasons why I created the trauma informed plant medicine facilitator training and also the somatic plant medicine integration practitioner training. And recently, the Somatic Foundations for Safe Psychedelic Practice immersion, which some of you, I think, have, participated in. So, with that, I would love to now hand it over to Devon, who is going to talk a little bit about becoming the instrument. So, this kind of philosophy that we hold in our mentorship program, she's going to talk a little bit about the vision, why we created the mentorship, what most psychedelic trainings overlook, and why it matters. We're going to talk a little bit also around practitioner presence and how it can be one of the strongest predictors of safe and effective psychedelic care, and also how our mentorship bridges both clinical and ceremonial approaches in a shared somatic framework. So I would love to, invite Devon to share her wisdom with us.
Thank you. Yeah, thank you so much, Atira. I'm always inspired every time to hear you speak about your own journey and what has brought you to this work. You're truly an inspiration, not only for the life journey you've had personally and all the healing work you've done, but really how you've taken that and translated that into helping so many countless people. And I think that is part of our shared vision, both of us. I mean, I alluded to my own personal healing journey over decades. One of the aspects of my early healing journey really involved being very disconnected from my body. And this, what we'll keep talking about, Atira and I, the importance of embodied self-awareness, or the wisdom of the body, and what the body here can the narratives that it holds, and also the wisdom and the healing imprints that are really, the body can be like a conduit to our discovery. Um, that's where Atira and I really connected. And I think part of that also connects to my personal healing journey. I was anorexic. I suffered very early developmental relational trauma and neglect. Later expressed itself through eating disorder, both anorexia and bulimia. And so my personal healing journey has involved this journey so far out of my body, to the point of really a level of hatred towards my body, and a sense of toxic shame in the center of my being, to all the way back to really a 180 from that, to be deeply embodied and deeply centered in this beautiful, radiant self that is in many ways beyond me. And I think the inspiration around the possibility that that kind of healing journey is available, um, is something that really motivates and fuels my work. And Atira and I, through our respective journeys, kind of have found each other and have found this mutual orientation that treasures and prioritizes so deeply the sensitivity of working with how the body stores trauma, and the very nuanced ways that in relationship we are wounded, but also we can heal as social mammals, as human beings. So um, some of that backstory is certainly part of the vision. I also wanted to share a little story that not a lot of people know about me, which is at one point in my journey in 2012, I went on sort of a pilgrimage of sorts to Cusco, Peru. I found out about and attended a 5-week shamanic yoga teacher training that was based in Cusco with the World Shamanic Yoga Institute. And it was really here that I felt like my prior years of working with yoga and meditation were explicitly bridged into the world of plant medicine. The shamanic yoga teacher training explicitly was about cultivating, in their terms, the science of consciousness in as a way to prepare to work in non-ordinary states of consciousness with plant medicines. So we spent hours and hours all day long. We would hike up a mountain to a beautiful ruin site that overlooks Cusco, and we would do yoga all day. We would either sit and do a 1-hour breath focus meditation or shamanic drumming on the lunch break. Deep cultivation of these science of consciousness practices and embodiment practices. We even practiced dream yoga at night. And all of this orientation to the work, the cultivation of consciousness and embodied self-awareness in order to meet plant medicines. It deeply informed my reverence for plant medicines, orienting to plant medicines and all psychedelic medicines as kind of an aspect of consciousness themselves, so that when my consciousness meets the consciousness of this medicine, where there's a relationship that I'm coming into. And so this preparatory work is really supporting my own active engagement, like an active responsibility, the refinement of my conscious awareness, and a deep trust in my own inner wisdom, such that I can deepen and learn from my relationship with the plant medicines. And there we were working with grandmother ayahuasca, as well as the beautiful cactus medicine of the Andes, Washuma. So this really became foundational to my personal work with psychedelics. And I tell this story because it very directly maps onto my orientation as a facilitator of space for other people who are themselves journeying with medicines for any purpose. But really, I do medicine work. So most all the time, I'm sitting with people who are journeying for some orientation towards personal healing or collective healing. And how I see this mapping in terms of being the instrument is it's really these years of work and cultivating myself that allow me to then sit as a participant in a relational field with another human or humans who are themselves cultivating their relationship with a psychedelic, with a plant medicine. And so the active responsibility, the reverence for the innate healing intelligence of that human, of that person, and the medicine they're working with, and the way they're engaging internally, and how my own presence is part of that whole energetic participatory field. And really, as an instrument, my nervous system, my moment to moment qualities of my state of being are informing and contributing to the container in which a person is having their experience. And it's really the quality of that relational field that we co-create as active participants, as facilitators, is a tremendous factor in what becomes possible for that person, for the participant, in the window opened up by the medicine. And I've now sat with hundreds of people in non-ordinary states of consciousness. And what's become totally clear to me, I guess, experientially, time and time again, is that I'm not delivering an intervention. I'm not just kind of sitting and, you know, providing a medicine and watching over. I become an extension, as I was saying, of the whole energetic field of the person's nervous system through something called co-regulation. And people are in very vulnerable, very suggestible, very neuroplastic states. So my participation is something that I hold with so much responsibility, so much attunement and to myself, because it's that self-awareness, embodied self-awareness, that's going to inform me about how I'm showing up effectively and how I'm holding the ground of ordinary consciousness and how I'm holding appropriate boundaries, despite the fact that there's all of this energetic and nervous system and so many different channels of experience that I'm participating with a person. So holding that kind of paradox of deep attunement and presence, and also being boundaried. And this is some of the stuff that we'll be going into together. And really precisely why Atira and I found such deep alignment in our respective work when we met on a panel one day talking about embodiment and psychedelics at the Embody Lab. And I reached out to Atira, said, can we have a virtual tea someday? Because I'm just so excited to find another person, another woman who is this passionate and this that has this much conviction about the importance of our responsibility and how we bring our conscious presence into this space. And that set off, a relationship that's so near and dear to me. And it's just a delight to teach together and bring our respective backgrounds and trainings and experience to all of you. And I think, what sets kind of our training apart from other trainings is that a lot of trainings are really focused on what you do, right? Um, Kind of the nuts and bolts of what you do. And while that's important, I think what's sometimes missing in trainings and what this mentorship is really about, it's not so much about what you do, it's about who or what you are being and becoming while you're doing it, right? Who or what you are being and becoming while you are doing the work, while you're being an active participant in medicine space with other people. Really coming from an orientation of relationship-centered care that you might have heard of client-centered or patient-centered care, and my orientation is honors that, but really goes a step further to name relationship-centered care because, again, we're active participants. I am touched by the people I'm working with every day, beautifully touched by, sometimes my own wounds are touched, right? And how do I hold that? And I find myself totally inspired by the beautiful wisdom and healing that comes from the people I'm working with. I think that's also really critical to convey, is that this work is not about being a healer, right? It's not about healing people. It's about facilitating a space that is going to be most optimally conducive to the innate healing in the person we're sitting with, right? That healing belongs to them, is in them, and our role is to create that optimal space that's going to facilitate the conditions that allow that to flourish. And I think I've spoken to this already, but really why our presence is so important, the quality of presence we bring, is not only the state of our nervous system, um, our clients, when they're wide open in under whatever medicine we're working with, it's like all the senses and channels are open. And so our state of our nervous system, our posture, our facial expressions, our breath, our respiratory rate, the ways we might micro hesitate, our embodied confidence, and whether or not we're fearful or curious or open, our attitude as facilitators, all of that is being in some way picked up, right, by the person that we're with. So it's another reason I deeply love this work, because it's a constant call to continue cultivating myself, my relationship to everything, and to actually be able to hold an open space that is going to be conducive to whatever worldview or spiritual background whoever I'm working with is coming from, and at the same time grounding myself in what's true for me, and being able to be fluid in that, right? It takes tremendous um, awareness, skill, ethics also. Um, so, and many trainings do teach ethics, right? And safety, and the importance of preparation and integration. And even the neuroscience, which I love nerding out on the neuroscience of this. It's another lens I deeply love and appreciate. But I think what's much harder to teach is really just how we remain deeply present when someone is dissociating, or when they're terrified, or when they're idealizing you, or when they hate you, when you're triggering them, right? Or when they're encountering God, or when they're convinced they're dying, right? These are the kind of places we need to be able to hold our seat and navigate with folks, to really support their safety and their journey. And these moments don't ask us for another protocol, really. They're asking something of us, something that we can only cultivate inside of us, that we can't read or learn in a textbook. And I think eventually, at some point, all of us as facilitators or therapists, we learn that one of the greatest limitations in the room is not the client's, it's our own, right? It's where we become anxious, or where we move into rescuing somebody, or where we're over directing the experience, or where we're withdrawing, or where we are uncomfortable with uncertainty and trying to control a situation. These are the moments that are our own edges that we need to learn how to expand beyond, right? So that we can sit with uncertainty, with confidence, and with curiosity. These are some of the attitudes that are really important as holders of space. So um, I think I'm nearing the end of my piece here. I think to conclude, I'll speak briefly to how what I think is wonderful about how Atira's orientation and experience is coming a lot from the ceremonial plant medicine traditions, and my own, having certainly done a lot of work in those containers personally, but I come to this from a medical and from a psychotherapeutic orientation as well, and how we found common ground together that bridges these different contexts, where clinical traditions often bring an emphasis on neuroscience, or understanding trauma, or ethics, documentation, record keeping, all of these things that are really important, and ethics, ethical orientations. Whereas, ceremonial traditions often, I think, bring a lot more in that has to do with reverence and relationship and the symbolic and the mystery and trust in in uncertainty and emergence. And I think both of us hold all of what I just named as highly important and as part of an overarching framework that is this integrative somatic psychedelic assisted therapy framework. All of it is important. The ceremonial reverence, the relationship, the mystery, the trust and emergence is as applicable in the clinical as these clinical aspects are to the ceremonial. And it all really comes down to embodied self-awareness and the mystery and the intelligence of life that we are living and breathing moment to moment, as are the people we're sitting with. And the framework that really supports us to do that as safely and ethically in a way that centers on that person's own inner wisdom, that marvels at the beauty of each person's unique healing journey. I say to people sometimes that it's like each person's own healing path is as unique as a snowflake or a fingerprint, and it's beautiful. And so slowing down and attending to these subtle relational moments, practicing being and not knowing, these are the things that really bridge clinical and ceremonial and are through and through where Atira and I connect and what we want to help cultivate in all of you and help really teach and seed the world with holders of space that can really bring people into deep presence with themselves and their own empowered beauty. So I'll end there and pass it back to you, Atira, to take us into the next section here.
Yeah, thank you so much, Devon. And I think that what really lands for me, what feels alive for me, is that this mentorship is really around, it's kind of so deep, right? So we're really talking about what we are teaching is kind of the invisible part of, being present, yeah, being confident and being curious in those spaces when where it's like a mystery, we all know that like psychedelics is a mystery. So how can we kind of, guide people on this path in the ways that you've kind of shared? So as you've kind of shared, a lot of this work is very deep. So we're going to share now a little bit around who this mentorship program is for. Um, and yeah, a little bit of some of the, I would say, kind of your curiosities, a little bit of the prerequisites for being here with us in the mentorship. So if you are either a therapist, facilitator, coach, a guide, healthcare professional working in psychedelic care, or perhaps you are wanting to work in psychedelic care, and you are yearning perhaps for a way of deepening your confidence, working with complexity, as Devon kind of shared, trauma, working in non-ordinary states, and you're actually yearning to go deeper. You want ongoing mentorship. You want supervision and reflective practice, not necessarily another certification, which is going to teach you, certain interventions or just intellectual, intellectual foundations. Not saying that, understanding things with the mind, it's very important. But here is really on a deeper level is learning from an embodied center. Another thing that we're inviting with participants is that, as Devon shared, this commitment to cultivate your own embodied capacity alongside your professional skills. I would say that that own personal growth, as Devon kind of shared, is one of the things that is so important in psychedelic care. That growth in awareness, that growth to meet layers of consciousness and complexities actually within yourself, so that when you show up with your clients, you can actually be in right relationship with yourself first and foremost, but also with your clients. You are committed to ethical, trauma-informed, and relational approaches, right? I think that Devon shared so much around this relational field that is so important, that attunement, that tracking of relationship, and how we are again coming back into right relationship with ourselves and our clients. Another thing is around working over the whole continuum of psychedelic care. So what is included in the program is that when we are teaching certain aspects, we are going to be sharing about, preparation, how you can start adapting some of these tools and skills from the preparation, from screening and assessment, all the way into facilitation, to post-ceremony care, and then also into integration. So we're really covering the whole entire arc. And also, I think one of the most amazing things about this mentorship, so I've run, this is my third year in running mentorship programs, advanced mentorships, that it's really the peer support, like the people that you meet in these containers, that you actually get to journey with for 9 months together. Some of the most beautiful relationships emerge. People co-facilitate together, people support each other in, their sessions. They run retreats together, and they actually support each other in a very, very safe way. And yeah, I just find that, as I work in this field, what I hear a lot is the isolation of the psychedelic practitioners. So we learn in community, we heal in community, we learn and heal in relationships. So I think part of the gem is for people that actually want to connect with others and to be supported, layers of support with each other as well. Now, a prerequisite to this mentorship is a foundational understanding of somatic psychedelic inquiry through prior training, either with myself or Dr. Devon Christie. So we teach on multiple programs. I think some of you have done the trauma-informed plant medicine program, the somatic plant medicine integration program, or the program that we shared in the embodied lab. And Devon and I both teach on different training programs. I know that Devon teaches at CIIS. We both teach at Synthesis. I teach at ICEERS, Inward Bound, and so on and so forth. So if you've done any of these other trainings, and if you do have a foundational understanding of somatic inquiry and how to work in psychedelic states, that would be a prerequisite to joining the program, because what we're going to be doing in the program is that we are going to be building on this foundational skill. Yeah, so that is something really important to know. So I'd like to talk a little bit about our curriculum so it feels really clear. As I mentioned, we are going to be focusing on working with the full continuum of psychedelic care, from screening and assessment all the way into integration. We're going to be touching on these foundational principles of ISPAT, the 5 invitations. So learning to trust and how we're working with that client's innate healing intelligence that Devon touched on, which is innately empowering. And when we are working with the inner healing intelligence of the client, the space that we're holding is an active space. And what we're kind of bringing into this active space is embodied presence and attunement, right? So that we, when we're meeting complexity, we are actually being with the client. We're not triggered into our own kind of survival responses, or, our parts don't actually take over. And with that embodied presence and attunement, we are going to be learning the language of the body, how to actually read the language of the body in psychedelic states through somatic inquiry, and also through those channels of PsyBAM as well. We are also going to be touching into working more at the layers of, the soul and the spirit. So bringing in transpersonal psychology, working with symbology, metaphor, working with the imaginal. So how do we kind of navigate the more kind of mystical, divine experiences with discernment? We're going to be working with complex system thinking. So really understanding that our clients are dynamic adaptive systems that are flexible and fluid, and they change. And we are actually supporting embodied change instead of, the emergence of insight, because insight only goes so far, right? It still only lands on the level of the intellect. But how can we allow it to land in the level of the nervous system and support a client to change, their system, their nervous system, their behavioral patterns, their relationship with themselves? We're also going to cover parts work in non-ordinary states. So we're going to be actually working with parts work and parts language all the way from preparation into facilitation and in integration, and understanding, that, preparation, the work with psychedelics, in my opinion, starts in preparation. Yes, it doesn't just start in the psychedelic non-altered state experiences. And when we can work with a client, when all their parts are in, this cohesive teamwork kind of attitude, then these experiences, these psychedelic experiences and the change can be so much deeper. We're also going to be talking about how to use a touch as well, whether it's kind of adaptive, kind of, touch, supportive touch interventions, the safety and ethics around that, or, consent and boundaries as well. And also variations of perhaps somebody that might not be open to touch and how we can support them as well. We will also be covering, navigating this edge of the window of tolerance. So really kind of recognizing in the body how to respond to disassociation, shutdown, freeze, fight, flight, and also overwhelm when it arises in psychedelic states. Then this is one of my favorite topics. So somatic integration, really supporting clients to translate, an insight to changes in the nervous system, behaviors and emotions in relationship. We're also going to be kind of touching on more sticky, kind of prickly subjects like transference and countertransference and also projection. So really recognizing and responding to relational patterns when transference comes up in psychedelic states, which they will, and really understanding how we can actually use transference to support healing for others. I'm really passionate and really excited to be sharing a little bit more about complex trauma, because I really love teaching these modules around working with CPTSD, neglect, and attachment wounds and developmental wounds safely and effectively. And also talking, finally, we are going to be covering relational ethics and therapeutic boundaries. This is one of the themes and topics that I hear a lot from facilitators, like how do I actually maintain healthy boundaries, right? How do I stop merging with my clients, let's say, or how can I, just have this hold a really safe container and still staying centered, in being attuned to others. So these are some of the subjects that we are going to be covering. Now, if you do choose to join us in our program, this is your learning experience and how you're going to be learning. So what we're going to be offering is a fortnightly live 2-hour mentorship session, which is an interactive live session. It blends teaching, discussion, experiential practices, and also case consultations and questions. So if you're a psychedelic practitioner, the invitation is really to bring in your clients, right? The questions that come up with your clients, also questions that you have around psychedelic practice as well, so that you can actually receive personalized supervision and feedback. I personally believe that everyone working in psychedelic spaces is so important to have a supervisor. So you're going to be receiving supervision from myself and Devon, and also your peer community as well for peer supervision too. So you're going to be receiving guidance, very practical guidance that strengthens your facilitation. It can help you to deepen your self-awareness and to be kind of curious and aware of your kind of personal edges and blind spots that can really support ongoing professional growth. So every month, there is actually a monthly learning theme. So there are focus modules where you'll learn subjects that are shared in the curriculum. But we are also going to give you things like frameworks. We're going to give you, I think I share a lot of resources. So, for example, things like intake forms, different kind of step-by-step kind of models that you can start to apply with your clients immediately. Then lastly, what you're going to be learning too is the experiential part, because yeah, we are the instrument, right? As Devon shared, we are becoming the instrument. So we are, our own personal development and growth really goes hand in hand with our role as a psychedelic practitioner. So there are a lot of kind of reflection and self-inquiry practices. There are a lot of somatic practices that I will share through videos and audio downloads that you can download and keep for yourself and practice in your own time. We're going to be sharing our own case studies with our clients. We're going to be sharing demonstration sessions, and you can also be a volunteer in demonstration sessions that we're kind of showing, and also practical application too. So what you're kind of going to receive with this mentorship, which I find really exciting, I really think that this mentorship offers something that is incredibly comprehensive. So you have 18 live mentorship sessions. There is personal supervision and mentoring throughout the program. You have a lifetime access to all of the recordings. But I think that one thing that really excites me about this program is all the parts in the middle, I think middle section. So you'll get a lot of learning materials, which include, reflection questions, both personal and professional as well. In week 1 and week 3, which are our kind of professional and personal kind of weeks, we'll share quite a number of somatic practices and guided meditations that you can kind of use in your own quest of embodiment. And in addition to that, we are going to be sharing a lot of kind of journal articles, the research that's coming up in the field, evidence-informed resources, book chapters that our colleagues have written and researched. And also, I think I'm really excited as well, and what I've seen very helpful with students are client worksheets. So you can actually share these worksheets, integration tools, practical exercises with them in the preparation phase and also in the integration phase. So in addition to that, there's also a private online community on Mighty Networks to connect with us and also the student cohort. And at the end, that certificate of completion as well. So if you're interested, I'd like to just share that our early bird actually ends on the 15th of August. So you get to save $500 on the early bird. So I'd like to kind of stop the share, and now I'd like to introduce or actually invite one of our old students who did the first mentorship program with myself. Carla, I'm wondering if Paal is here.
I am.
Here
I am.
Welcome, Paal. It's good to see you. Yeah, really happy for you to be here. Yeah. So I know that you actually joined us. I think your journey is that you joined us for the TIPMF program, then the SPMI, and then you decided to join us for the mentorship. So yeah, please feel free to share your experience with here. I'd love to know.
I feel your training is like your SPMI training and integration training, and it kind of built the foundation. And there was a lot of knowledge, a lot of practice, and but I felt when we come up to the mentorship, it's the teaching comes alive, and also for me holding space. Who is my mentor? Where is my weakness? Where can I bring my cases? And what I liked with the mentorship, it was like a smaller group, and we also had a buddy group, like with 4 people, I think 4 or 5 people. And we met and we shared and build a bond, and then also we could bring all our cases. So I felt more or less all of my cases which came up during my ceremonies, which I was struggling with, and I could get the reflection and feedback on these things. So and yeah, and I loved your articles also. It's like there was like honey in the chapters you brought in. It was like, it's so to be seen in my challenges or my weak spot, and then get information how to face this challenging situation which comes up, and then it's normal, it's a part of it. And so it's a beautiful container to grow. It's quite with all your programs, it's pretty full on. It's a lot of information, it's a lot of practice, and so it takes time to integrate it still. And but if you really want to dive in, you can get so much valuable information, practice, and embodiment as well. And it seems like you have Devon here. I really like that, your combination there as well. So I think your program is so valuable, and it's amazing.
Thank you. Thank you so much, Paul. And I think as you're kind of sharing, what I also love and remember from your part is that you took all of the information that was shared and your own kind of personal wisdom and your experience with facilitation, and you kind of created your own map for your clients that you're serving. And towards the end, you did this beautiful presentation of how you had harvested all this, wisdom, and you adapted it to your clients and what your clients actually needed, to enter that ceremonial space with you. And you created all these amazing resources for them. And just hearing your stories afterwards of how you applied that, it just felt really deep and really meaningful. And so much of that I feel is so missed, especially in the ceremonial kind of culture, just that preparation and psychoeducation and all those resources that you created for your clients and for your participants. It was also really beautiful for me to support you. Yeah. So thank you so much, Paul, for sharing your experience. Yeah, I'm so grateful for you being here. Thank you.
Thank you.
Thank you. Yeah, so we have some time, 2 minutes for questions. Maybe we can take one question before we end. So Carla, I'm wondering if there are any questions that are here.
One that came in from Daryl was just just double checking that all the sessions during the mentorship session will be recorded in case people are not able to attend live.
Yes, so I'll answer that. So yes, everything is recorded and you have lifetime access to the recordings. So our platform is on Kajabi. So we after we finish a live session, usually takes around 48 hours for it to kind of upload. And you get the audio recording, which is downloadable. You also get a video, and we also share the transcripts as well with you. Yeah, so you get that all. I know that both Devon and I, we work with clients and we have recordings, like demonstration session recordings, which we are going to be sharing with you, as well as some kind of bonus demonstration sessions. So you can also access those sessions as well on the online library. And also, in addition to that, I share quite a lot of somatic practices, which you also get on video and also audio to download too. Yeah. So that's a really good question. Thank you so much for asking, Daryl. Okay, so as we finish, I might just add Devon here. don't know if you would like to share anything, Devon, before we finish. But before we end, I'd like to share that our early bird ends on the 15th of August again. And if you still have questions or if questions pop up, you can also book a call with our Clarity team, and they will be very happy to answer any questions that you might have. So maybe to finish, you might want to share in the Zoom chat, or maybe there's an option to share one word of what feels alive for you now, or maybe something that felt inspiring for you that you might take into your psychedelic practice. Maybe 1 or 2 words here as we wrap out our information session.
Relationship and deepening. First 2 words that popped up. Beautiful.
Rooted. Yeah, beautiful.
Definitely I have a warm heart from being in this space with all of you and with you, Atira and Paal. A really warm heart carrying me into the rest of my day.
Absolutely, absolutely. And I see in the Zoom chat, Shelly sharing that she feels alive and grateful and lively. Danny sharing grounding and deep love. Beautiful. Thank you so much, Danny. I know that Danny is joining us for our mentorship program. So happy that you're here. And Paul is sharing that he's happy, and I'm feeling really happy too. So as we wrap up, I think that my word would be grateful. I feel, really grateful to, be in connection with all of you here. Yeah, very, very grateful that you're interested in working with psychedelics in a different way, a way that is embodied, a way that's deep, a way that is relational, that goes into kind of, the real deeper layers of consciousness, deeper than just the mind. Yeah. So I'm really grateful for that, because there are many different ways of working psychedelics. And I believe that this way is something that's very unique and less trodden on, the path that's less trodden on. Yeah, it's really a path, as Paul says, that takes commitment and dedication, but the rewards of what you reap is really thousandfold in my experience and opinion. So I feel grateful that you're here and curious and interested. I hope that you'll join us in our mentorship program. Yeah. And if you have any questions, please feel free to reach out. And lastly, before we end, I want to just really give thanks to Paul that came here today. Thank you so much, Paul, for sharing from your heart. I'm so grateful. And lastly, I really want to thank Carla, our assistant. She's been assisting me for for many years now. And actually, this is her last session that she will assist for a while. So thank you so much, Carla, for being here. I'm so grateful. And thank you to all of you. Take care. Have a beautiful day. Bye-bye for now.
Thanks, everyone.